My guy.
You can't turn away such a handsome man as this guy. All right, we're gonna get a little
Hey, how's it
bigger.
going?
Look at him, he's smiling off like $100 there. He's been following me forever. Yeah. All right, so short and sweet. Tell them what we're doing.
We are going to straighten the bridge and then slightly upturn the tip, and that's about it. No ski slope.
Okay, so
Straight bridge.
we're talking Humpty Dumpty, right? Working a nice tip, slightly rotate, and his nose is pretty big. His face is very narrow. He's got what we call a high tension nose, where this is just projecting. So you can imagine we're going to just sculpt this down to some degree too. We're making his nose smaller so that it's just smoother and more natural, and actually works for his handsome good looks even better than his nose. And this is his dad's nose, by the way. Mom has totally verified that. This is dad's nose. So male rhinoplasty, a little bit harder bones, a little bit this, a little bit that, but pretty much the same principles. So, and the good thing about his nose is it's bigger than usual, so therefore you're going to be able to see the anatomy a lot better, which is really kind of cool as well, right?
Yeah.
He can't wait. You can see my anatomy.
I'm ready.
I know you're ready. He's born ready. All right, we'll show you how we're done.
Perfect.
He's ready.
Real quick, I want to bring your attention to something. We really appreciate you guys watching, but 96% of you, 96% are watching these videos regularly and you're not hitting the subscribe button. So please go do that now. When you do that, it helps us grow our community, it helps us get the word out, educate others, and in turn, just help others, okay? So hit the subscribe button and continue watching.
So this is the delicate part of the procedure where I'm separating the tip cartilage from the surrounding skin. It's where you slow down.
Yeah, I noticed his mom on the way out. She had an adorable nose.
Yeah, they had no problem saying it was dad.
Really?
No, not whatsoever.
Huh?
His dad has had a rhinoplasty.
Oh, really?
Oh, he did, yeah.
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 Mom had like a textbook.
Oh, really?
Yeah, she-
So the men usually have thicker, tougher dissections, thicker bones, for sure, bigger noses. So actually when I talk about feminization of the female nose, it's because it has features of the male nose, you know. He doesn't complain of any breathing problems, but he definitely had some anatomy here that I needed to adjust a little bit internally before before I even got to this point. You didn't show that, did you, Micah?
When you clear out the septal.
Yeah, yeah.
No, I didn't see that in
Yeah.
this one.
One of these days we gotta show that because it's pretty cool. You know,
can
I'm
really
gonna
see
do this at a. I'm gonna do this as a one-piecer. This is.
It's a brand new.
Oh yeah.
Yeah.
Wow.
Yeah.
Darn.
I know. I just changed it.
He's good at strong.
That or the blades are just not that strong.
So instead of taking this down in parts, I'm doing one fell swoop here because it is a. Oop, nope, nope. Because it's so big. All right.
It's a cop.
There we go. There's a start.
Want to see that? Yes. Ah.
So we just start with that because we know he's got a big septum. And we're gonna have to reduce a lot of things here. And we showed some pretty good stuff last time, didn't we, Mar?
Oh yeah.
Oh yeah, y'all showed all the pieces.
Yeah.
Yeah.
We got this whole huge piece here. All right. Knife. That's it. All right. All right. A little bit more. All right, the more we're gonna use the chisel.
He's never had a broken nose or anything.
I think he did say he had some history of trauma to his nose. He keeps calling it crooked, but yeah, it's not that crooked. All right. So we're gonna go after the bony part here. Like this, yeah.
Wilson, can you turn the section on?
Nice. All right.
Okay. You can turn it off, Wilson.
Chisel.
Mm-hmm.
Mm-hmm. Mm-hmm. Okay. Mm-hmm. Mm-hmm. Okay. Mm-hmm. Okay. All right.
It's off.
I wish I keep asking for a non-tooth, you know, you keep in the tooth. Suction, sir? Playing the war of the grapes here. All right, suction, chisel.
Yes.
Suction down the pike there, Mark.
Oh, I got a piece.
Yep. Okay, hold on.
Awesome.
All right, so I'm still working to get this obstinate nose down here. Got this over here. I just got more cartilage. Okay, knife.
This cartilage is still protruding, not bone?
Yeah. Bone I got down. This cartilage is still pretty big.
Cartilage doesn't, wouldn't break and heal larger, would it? Only bone?
It would what?
Like break and heal larger, scar?
Well, that's uncommon.
It's not a tissue that really scars.
Yeah, bone.
It's still attached.
Yeah, I see that. Okay.
Well,
All right, out.
it's substantial.
Back. All right. No,
Want
the
knife or-
knife, yeah. Suction.
Wilson.
All right, so we got the idea where we're going here. Super wide now. Still got to reduce this even more. But I think what we're going to do in the meantime is just work on this tip just to see where this huge mass here is going. So, force it. So we're establishing the tip now, trying to make it smaller, narrower, and smoother. And that's with sutures.
Do you approach the male tip much differently, or
Say what?
do you approach a male tip differently than a female tip?
Same approach. Just you know, you end up having to do what you need to do. You know, so what's kind of interesting with him, it's you're just ending up doing a lot more of the same thing. You know, just volume-wise. You know, the amount of material that I'm removing is huge compared to others because his nose is just simply large. So compared to the female nose, like the ones we did last week, it's just bigger. And I'm going to shorten his caudal septum, which is over here as well, because his nose is just super long. So we're going to shorten that up as well.
It's over here.
Mhm. So really what I'm doing here is just sort of working in various areas, moving it all in together. It's like a seesaw. Change here, we're going to change over here, we got to keep it all in balance. Okay, calipers. So he's got pretty big upper lateral lower lateral cartilages here. So we're going to 6, 7. Okay. Locale. All right. So this is going to reduce the overall size of his tip. And in between, removing this cartilage. It's a big reshaping. By knife.
Can I have another 15, please?
Just don't cut. Mhm.
Here, let me get to another one.
Yeah. So you can see the difference between the side that's been trimmed and the side that hasn't. So here, I can show you a little better here. Loosen this up. There you go. So you see the width here and the width here, totally different. Oh boy. What a difference. I actually have an instrument that's sharp here, so makes me look like I know what I'm doing.
Better blade.
Yeah.
Mhm. Brand new one.
All right. Okay. All right, let's see what that does. So you can see all this volume back over here is reduced now. Much smaller, but it still has, they're a little long, and as I've reduced this, it's hitting the edge over here and it's buckling out a little bit, so I might trim that down. Huge area up here is still his. And he's got a bunch of septum here that I gotta reduce, so let's go after that now.
I'll go first.
Yeah, a little local. Forcep. So I'll do a caudal septal trim, which basically means, see this? That's the end of that septum right there. You see that? We're going to reduce that. It's overgrown. Whole septum's overgrown.
Mm.
That'll shorten his nose, and we'll get a little bit of a rotation too.
Patrick, can I have some more Rentex, please?
All right, knife.
One, two, three, four, five, six, seven, eight, nine, 10.
So now I'm exposing the cartilage on the septum.
Can you see that, Micah? Because it's pretty.
Blends in pretty good, so it's
Yeah, but it's cool how big that is.
yeah.
It's this.
So here it is here, and going down here the nasal spine, down in here, which is bone.
Wilson, can you do this section?
All right. So we got this whole thing, and we're going to shorten it. So I can only take this down to the bone, right there. And that's it. So look, that was there. And that's going to change the dynamics
Oh.
a bunch.
Yeah.
Table up a bit, sir. That's good, right there. Okay, so we shortened that. See how that rotated? And he's still a little full here. I might get a rondure and reduce a little bit of that. It'll make his lip, upper lip, a little less crowded. He's got some bone right here on the spine I'm going to reduce.
I'm just telling you.
see rongeur.
Yes.
See
it's an
these,
instrument.
this cartridge is still long here, these lateral curves, so I'm gonna have to reduce them because they can't go back because it keeps abutting these two sides like that. So I'm gonna work on that in a minute. I still have to reduce this little septal cartilage, and we're gonna go after the nasal spine. So I'm gonna need a rongeur. Mike, if you come over here, I can show you. Double hook.
Yes. Get the wider one.
Okay, so Mars showing me this.
Thank
and
you.
then down in here, this is a rongeur, by the way, that in my hand.
Just the
So force it.
instrument. Yes, of course.
And the rongeur works on bone. Feel coming down
You
here.
don't walk around here. You're getting it on this, and then it's on my feet now, and I'm taking it out there.
Oh,
Oh, yeah, look.
I've been yelling at him all morning. It doesn't seem to change anything. Take your freaking shoes off. All right, that's good. I got that.
Okay.
So I got some of that bone out that
Yeah,
sits
I
down
can see that.
in this area here, and what that's going to do is allow this to collapse a little bit more, and it makes his upper lip a little longer. See that? This distance will be a little longer. It'll just be nice. So you're kind of getting the idea of what's going on. Nose is shorter, dorsum is down, tip is better. This whole relationship here is a lot better as well. Longer upper lip, it's all coming together, but we still have some refinement to do. He still has a little bit more dorsum cartilage up here than we need, so I wonder, yeah, we gotta reduce that more. All right.
What do you?
It's a mirror.
All right, knife.
It's a mirror.
Hold this tip down.
Yes. This is a brand new knife.
Positive.
What?
Positive it's a mirror. Because it didn't go over there and it's over there.
Pull down.
I just don't want to.
But she did.
Thank you.
Okay, I think that's good. Fighting the battle here of the drips. Oh, much better. Okay.
Well.
So, getting closer. And his skin is retracting. Now, look how wide he is,
Mm-hmm.
obviously,
Yeah.
now. Okay. So the thing that I not loving is that these cartilages here are pretty splayed out. Okay. Forcep. It's because as I set it all back, it's just too long. So I'm going to reduce. All right, let's get this side. The length. With a little back cut. So, knife.
Yes.
Boom. I took a small piece out of there. It's going to allow that to set back, and then same thing on this side. It's like if the legs on a table are not flush, and you got to adjust them. Boom. All right, good. So now this allows those cartilages to lay back. Voila. Very nice. Very nice.
Oh, that made a big difference.
Huge nasal bones here. Humongous. So that's a nice relationship here. This is pretty good. Huge bones, golly. It's amazing. All right, stitch. So his septum isn't straight. Few people have a perfectly straight septum. The implication really is that his nose is not going to be perfectly straight. Really what I'm doing now is securing that columella to an area on the caudal septum that is better. Okay. I'm actually dealing with a lot of extra skin now too, because everywhere it's like this skin on his inside here, where the framework becomes smaller, then the skin is proportionately larger. So I may have to trim some of that skin. That looks good. So it's really kind of weird. Look at this. This looks fine, but then this is just ginormous, particularly if you see from above. So we're going to, let's break these bones and see if we could make some headway here.
Yeah, like in your thinking is.
So the seesaw, this is real huge now, and this is a lot smaller, so we're still working to bring that into a better balance. This is the part that causes the bruising around the eyes. Look at that, he bent my needle.
And it's probably more than just closing the roof.
Say what?
You probably have to do a little more than close the roof.
Well, we're gonna have to kind of make, like I said, you can see how I'm doing. This one's a little different. I'm making these changes, but then I'm gonna have to come back and check them. Oh, I need you on your A game. I need you to be able to fracture on this side.
Do you want to sharpen this?
Yeah.
Since
Yeah.
that's
But I need you not to be so handed.
That's fine.
Oh wow, look at this. Where'd this come from?
We got it.
Wow.
Oof. I do not like that sound. Yeah, I can't handle that sound.
Wow.
Okay. Yeah. He's got some.
Feel like a new life. New everything.
Like,
Okay. Uh-huh. Mm-hmm. Easy. Go. 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 Ooh. Go. Nice. Mm-hmm. Go. Go. Okay. Uh-huh. Go. Woo. Bam. Easy. Go. Good. Go. Ooh. Go. Nice. Easy. Good. Come up over here. Go. Go. Good. Nice. All right, I think that may be enough. Okay. Go. 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 Ooh, what, you hear that?
Yeah, I can hear that.
Go. Go. Good. Mm-hmm. Okay. Go. All right. So we got there. Right there. Up here. Nice. Go. Go. Oh, good. Okay. I think we got some movement here, so let's see.
Yeah, I'll take the one. I'm just preparing.
It's a little different, huh?
Oh, wow. That is incredible.
I thought you were gonna have to go in there and shave down the sides.
Well, Okay, force that more. Alright, scissor.
I know they don't. That's why that's stupid. But they're stupid.
Alright, stitch.
Yes.
Just blood everywhere more. I can't see
Well,
anything.
front finger, just put some on.
I need over here more. If you could slide this maybe closer to last time. You're making this look difficult. It needs to be. Oh, the whole needle just turned. Alright. There she goes. Oh.
Looks like you need a straight needle instead of a curved
Yeah, ideally.
Yeah.
But then you got 1,000 different needles.
Yeah.
This is not right here. There we go. That's better. All right. Made that look challenging. All right. I still feel fullness right down in here. I have to go after more of that bone down there. So we're going to take that stitch out that I put in. Okay. All right. Sure.
Yeah, okay. Open it for you.
Oh yeah. Oh, lovely.
Exactly what you wanted.
Yeah, yeah. See how that, it's subtle, but it's real. All right. Put our stitch back. Let me show you where it is, Mark. It's a little deceiving. It's not
Yeah.
it's not straight, but it's right there. See it? Right there. No, but don't push it up. Just down a little bit. Right there. Yeah. Okay. Let go. All right. So I have some extra skin here I gotta trim, that's for sure.
Wow, that's a big difference. Look at that.
It's
Under-
changed so much.
That is a wow.
They like had to be pulled back.
Yeah.
I don't know if I've ever seen that.
Well, that's what he just did with the stitch.
Yeah.
Yeah. That is
All right, give me the
Yeah, he's blown away.
What do you want? Angle?
scissor. Yeah, angle is
Okay.
fine. So I'm trimming some of the skin now because he's got so much more skin because we made the nose.
So much smaller.
Hook would be better. So much smaller. So there's just extra skin. Skin's got to go somewhere. Okay. Yeah. All right. Well,
I'm gonna
much
clean
we
it
can
up,
do.
though.
Wow, that's his nose. Holy moly.
Yeah. When you look at the difference.
Well, we'll clean them up, put sutures in, Mike, and then you can take some video at the end.
Okay.
Audrey, could you, I'll get you that. Could you, I'll count with you, but then also could you let Lacey turn the door down? Right before that.
job, Dr. C. It's amazing.
That was. Yeah, you're good. We're done.
What, Micah? Do his thing for a second.
Okay, so tell us about the swelling and stuff. So he said, what he said. What did he say?
So day 3, barely any swelling. I did feel like a little bit under my eyes, like if I would look down, but other than that, I hardly bruised and I didn't swell a lot. I had absolutely zero pain except for last night because the inside felt a little raw, but it was really, really easy recovery.
We paid him big money.
I mean, I'm kind of surprised because it was an
Oh, it
expensive
was a huge
case.
It was a huge case. Yeah, it wasn't like it was some kind of little cutesy nose. This was a good nose, which is good news. All right. So you want to give me those instruments there, Micah?
The splint is barely hanging on.
Is it? Did you have to push it down and everything?
Yeah, I've been pushing it down about every hour. So
Seriously? For
Yeah.
how long?
yesterday and today.
So that would be, so it lasted a good 5 days,
Mm-hmm.
which is most of this stuff. That's the problem with those splints. Use a different splint when you. Oh yeah. Heck, he could have taken his thing off by himself. Like, peekaboo!
Could have sneezed it off.
Yeah, sneezed it off. Yeah, you're right. Peekaboo!
Oh wow.
Yeah, this thing's off. Oh, they're over here. Hello.
Hello.
Didn't see it yet
Hello.
though.
Pretty small down here. But... Now, isn't it amazing how big of a reduction?
Mm-hmm.
It's swollen here. Woo! You didn't peek? Not gonna lie.
I did not. No. I was on FaceTime with her last night and I was like,
Grab
should I
that,
just take it off?
Yeah, grab that. Oh yeah.
But I didn't.
Wow.
Looks awesome.
Pretty wild, huh? So he's pretty swollen too, so it's really
Yeah.
unfair. But you can actually appreciate everything already, right? Without a doubt. But in his case, he's just mega swollen. So a lot of the fullness that we have is over in this area here. Where I spent a lot of work kind of refining down over here, so it was a better angle and all these things, and then working in that tip and getting that dorsum down and getting those nasal bones broken, all this kind of stuff. Whoa. Yeah, isn't that amazing?
Mm-hmm.
So the
That's
balance
very
is his tip is now is bigger than his tip. Well, it's actually a total balance. What do you think there, Senorita?
I was listening.
Ah,
I think it was really good though.
It doesn't even care, you know. It's like, look, I don't want to be in it. I don't want to be in the show here. Pretty amazing. All right, so let me take a look. Oh, well, actually, you know what? Get that mirror there, Amira. Amira, get that mirror.
I'm so excited to watch the surgery.
Oh
Yeah.
yeah.
I'm so
I'll bet
excited.
you are. It was a good one if I recall, but we did a
Oh.
lot lately, so I'm trying to remember. Your case was do you remember?
Mm-hmm.
I just did your befores and your afters. Then he got.
He had a big bone piece, didn't we? Was
Right
that
here,
enough?
you had to remove some stuff.
Oh,
here.
a lot of underneath the nasal
Oh, I had a lot
spine.
of cartilage right here.
Well, bone actually.
Oh, bone.
The nasal spine. So that's why it's funny how you say that it didn't hurt until yesterday because
I know it was.
I broke my nasal spine in a fight. Before my nose is crooked, and it hurt. I mean, my whole upper lip was kind of numb and stuff from being displaced, and his we just reduced. Here.
Let's take a look.
You sure?
I want to look.
Wait a second. I'm not so sure, man. I mean, hold it, but hold it together.
Okay.
All right, let me take a deep breath. All right. You're up. Go.
I can look now.
Go.
Whoa.
Whoa.
That's completely different. I had a dream last night that I was getting it off and it looked just like this, just a little more exaggerated because it was a dream, but
I love that. Yeah.
oh my god.
Which we say always tell everyone we under promise and over deliver, meaning like a big nose. We'll just make some small changes. This is as normal as a day is long. And he's uber swollen, so we got to get you back. Obviously,
Yeah.
we're not
It doesn't
putting
even look that
we're not-
swollen except
Oh,
for right
you could
here.
tell.
Yeah,
You
it's
kidding me?
gonna-
All
it's
over here in the
gonna-
nasal bones, the whole tip, everything's really swollen. But even having said all that stuff, it still looks pretty. It still looks pretty freaking amazing.
Only thing I see is this right here, like this little bump, but that's like, I don't know what that is.
That's nothing. Don't worry about it.
Well, I mean, it's like on the inside of my nose too. That's the part that hurts.
Oh, that's your cartilage in there. That'll go. Don't worry.
Well, all right.
Let me see. It's crazy.
Mm-hmm.
Crazy,
That is crazy.
crazy.
It's crazy Marin's difference too.
Oh, here we go. Now I gotta do this thing here.
My cousin
see
got
side by
a
side.
nose job.
Yeah.
What, 2 weeks,
so
3 weeks
sweaty.
before?
Yeah.
Yeah.
And it's I've seen 2 people get nose jobs. And
Oh, look
I'm
at you!
never
You're getting
gonna
all.
see anybody else
Yeah,
get
yeah,
one.
yeah.
My eyes look pretty.
They do. You got pretty eyes.
It's like looking at an old friend.
Mm.
It's
But
strange.
see, look how this particular area. So
Oh,
your
yeah,
upper
right
lip
there.
only went from here to there.
Mhm.
Okay, look now, and you're swollen. You got a whole upper lip now.
I'm also sweaty.
That's all right.
Guys.
It's exciting, sweaty. I'm also sweaty, and you're also swollen. But like I said, this is just gonna be the cool thing to look at. All right, let me take a look in the back of your nose here.
It's strange. Right before my surgery,
When you-
I
There's speculum over there. Is there
No,
some?
I've
No, is there
noticed
something in that?
There's not.
There's not. Okay, I can see. Put your head back up. Yeah. Okay. Good. How's your breathing?
it's great. Only thing that's obstructing it is on this side. It's like that little bump on the inside. Mhm. But aside from that, like when it wasn't swollen, like after I took my splint out, or
Yeah.
what is it?
And she's gonna clean you up, but
Inside.
yeah, you're mega swollen. And then she's gonna teach you how to tape your tip and all this kind of stuff. Wow, pretty phenomenal. Like, yeah. So what I'd like to see is the transformation, even from like 4 weeks from today.
Mhm.
And you know, it's just like, "Wang," he's gonna tape his nose and all that kind of stuff. So it's gonna be pretty awesome. So time is on our side when it comes to rhinoplasty. I gotta tell you.
Looks great though. I'm excited for you.
It changed my smile.
It did.
You feel it?
Yeah.
Oh wow.
Especially like where you're talking.
You
about
see,
that,
his
yeah.
problem is I already knew this was coming because he was pretty confident and pretty cool to begin with.
Oh,
Now all
yeah.
of a sudden you do something like this and it's like, oh my God, we created a monster.
Watch out for me.
Watch out. You know, if you notice that in him, that he starts getting a little like, I don't know, how would you say? He's too cool for us. You know what I mean?
Because his nose looks better.
Yeah, exactly. And all of a sudden he thinks he's just too cool for us
Too cool for
ordinary
school.
play. He needs to be on like the what was the show that was last night? The Emmys, the Grammys,
Oscars.
whatever. The Emmys,
Same
the Grammys, the Oscars. He wants to be an Oscar-winning. Check out my nose, kind of thing.
Mhm.
I'm happy for you.
Hey guys, you're right.
Behave yourself and all that kind of stuff. We're gonna have you back in a few weeks, and there'll be another epic video of it. You didn't get in it. Don't worry about it. I mean, you should.
Oh,
You
I
talk
know.
about beautiful. Look at this girl. She was amazing. She was in the. There you go. She was in the Grammys.
Are you family or friend?
Oh, best friend.
I got it.
Oh, I love that. I'm best friend. Look at you, beautiful. Look at you. Are you ready for your whole thing?
Oh yeah.
Oh my God. All right. So, ladies and gentlemen, look at you.
Thank you.
He's
That's
all-
my grandma. All
Is
my
it?
grandmas, yeah.
That's funny because it's funny. My dad has a watch that's a similar kind of style. It's a smaller face. I mean, all the watches now got all big and stuff. But he says this is grandma. It's my dad would have been 109 actually a week ago. And I got his watch and I wear it. It just looks a little small on me, but then I like it because I like it.
Yeah.
Family.
He's nostalgic. That's what that means. All right, so here's my man and here's his nose. So tell the world what it was like. Tell us where you are. Tell us how it's changed you.
Well.
Wow, that's him. All right. Well, there we go. Yeah, look at that.
Well.
So, wow.
It's gotten.
So he looks more sculpted, right? Would you agree with that? He looks more, it almost looks like a nose that he would have had, right? Because this looks a little generous on the front of you, a little bit wide. But now, don't use my words. I want you to narrate as we go along. So frontal view, what do you see?
Well, I think this is called the mandible bone, right? Am I wrong?
Mandible's down here.
Down here. What is
Maxilla.
it? Maxilla. So when I smile, I don't have that big, I guess, piece of cartilage or bone right here.
Yeah.
So I can smile, and it's perfect.
You can feel it, or
Yeah, I can feel it too. I used to be able to feel it like push out.
Yeah. So we did reduce his nasal spine up over here because if you look on let's say see all that? Oh, that's perfect. Yeah, get that, Micah. See this? All this fullness down in here. Look at that. See this? And now look how cut he is. That's world class there.
It's perfect.
That's world class. I mean, look at that. And that's also shortens his nose, gives you the illusion of a short nose. Got a beautiful guy's nose too, an elegant nose, nice tip, beautiful tip, nice straight dorsum. Base of his nose, the balance, the shape, all that is different. But that's funny you mentioned that, and you can feel that.
Oh yeah.
And then look at his upper lip. He just has more of a normal upper lip.
Mm-hmm.
And so when he pushed on it like this, he could probably feel his nasal spine. But that's what we reduced. That's awesome.
And then right here too, where y'all took out the bone.
Well, you had some wide bones there, buddy.
Yeah, it's changed my face a lot too.
What are people saying? Did they even notice?
Well, I've brought it up in conversations because I have a friend who got a breast augmentation, and we had a whole conversation, and everyone is like, your nose is perfect, but they always say they would have never guessed.
You never guess you had it done, except if you saw his pictures. Mm-hmm. That's awesome. That's a compliment to me because it's like, you made my nose look like a normal nose, and nobody can even tell I had my nose done. But if you were to see his nose to his old nose, but there were some people that had something's different because it's not just your nose, it's your whole face.
Yeah.
It's your whole face, and that's an important point. So when I see him, immediately I can't tell you the details of his nose unless I look at the worksheet, but I could just tell you his face looks different.
I'm happier.
Oh, that's pretty cool.
Face of joy.
Look at that, yeah. So what else? What else can you help people think about this stuff?
I mean, it was easy.
How's your breathing?
Perfect. No issue at all.
You didn't have an issue before, did you?
Nope.
Okay, so your issue is not any better, but it's not any worse.
Mm-hmm. Actually, a lot better.
Ooh, which I always tell people because sometimes I do pretty good rotor-rooter down in there, and so I don't remember his particular case, but I have a really novel way of rotor-rooterizing the nose so that people's breathing is better. I have a lot of people now that are just requesting rotor-rooter. How weird is that?
Wow.
Well, I had some people that had getting their nose done, and they came in with family, and then they're like, hey, I can't breathe. You think you can do it? I'm like, wow, I mean, I guess I can add that to the agenda. So you're happy, Kat? You happy, man?
Happy doesn't.
I mean,
it's not even good enough.
Man, I'm happy for you. I really am. You know that. And thanks for doing the
It
video.
has changed my life, and I'm so excited to watch the video.
Oh, you want to? He wants to see his
I
own
wanna see
video.
the surgery.
So you haven't seen it?
No.
Oh, so this is.
This is the closing chapter.
Oh, okay. So we got this whole chapter coming. All right. So we're gonna see. Did we video?
Yeah, we did everything.
We did everything.
Yeah.
Like when we first were discussing.
Yeah, everything.
In
Oh,
February, yeah.
So we were discussing the surgery, the pre-operative, then the surgery.
We did the pre-op, the surgery, a post-op reveal,
Mm-hmm.
and then now this.
Oh, we got the reveal,
Mm-hmm.
and now this.
Yeah, and in the reveal, it was still small. It didn't even look like it was up.
Yeah,
It was
yeah.
straight.
That's always the problem with a reveal
And so
because.
they're really gonna see it.
Yeah. So now they're gonna. Oh, so this is gonna be a great video, ladies and gentlemen. This is really kind of you're gonna see the whole thing, and we appreciate you.
I wanted to do it.
I know you did, but we hear that all day long. But people don't come back for whatever reason, and then they're. But you did, and you stuck it out, and I like this young man. I'm telling you, I appreciate you
Yeah.
a lot. I really mean that. So when is the movie coming out?
The next couple of weeks. I'll make
Oh,
it happen.
I'm gonna.
We got it. Well, what are we supposed to do? We got to send them. You got to send them.
I'll email.
All right.
Now me and my mom can watch it together.
Oh, no. But watch it together and don't say it. And then drop me a note and tell me what your impression was.
TV too.
Oh. Drop me a note because I want to know what his reaction is going to be. And you're going to be like, ew.
No, not me. Me and my mom love that stuff. My dad is probably gonna lock himself in his room.
Oh, because he didn't like it. Yeah. But you and your mom would be like, oh,
Oh
look.
yeah.
Look at your bones. Look at your
Like,
cartilage.
look at that.
That's going to be wild. Oh, my God. This is actually, I'm looking forward to it. I want to see his video as well.
I know.
Coming soon.
Coming soon to a theater near
If
you.
you're hearing this, you're watching it.
Yeah, exactly. All right, we'll see you. I appreciate you.
Thank you so much.